How do Hounsfield units, WHO, help with lung cancer CT scan results? Imagine you're looking at a detailed map of the inside of your lungs, where each part has a different shade and brightness. Hounsfield units are like the numbers that tell us how dense each part is, helping doctors understand what they see on a CT scan. These numbers are crucial because they give an objective way to measure tissue density, which is especially important when trying to tell if a lung nodule is benign or potentially cancerous. So, what exactly are Hounsfield units? They are a standardized scale used in computed tomography scans. Water is assigned a value of 0 WHO, air is around -1,000 WHO, and very dense materials like bones can go over 1,000 WHO. Soft tissues and lesions fall somewhere in between. This scale helps radiologists compare different tissues accurately, no matter what machine they use or where the scan is done. When it comes to lung nodules, WHO measurements are very helpful. Malignant lung lesions usually have a mean WHO value between 30 and 50 on unenhanced scans. Their maximum WHO values tend to stay below 150, and their minimum values are often between -30 and 20. If a nodule's WHO falls outside these ranges, it might be more likely to be benign. For example, benign nodules often show lower or more variable WHO values and tend to enhance less after contrast dye is injected. Contrast enhancement is another key factor. When a contrast dye is used, doctors look at how much the WHO value increases in a nodule. Cancerous nodules usually show a significant increase, more than 15 WHO, because they have more blood vessels, which makes them more vascular. Benign nodules tend to have less enhancement, usually less than 15 WHO, indicating they have fewer blood vessels. This difference helps radiologists decide whether a nodule might be malignant or not, though they always consider other features too. Using computer tools to analyze WHO values makes the diagnosis even more precise. These tools can generate histograms or detailed profiles of the tissue density within a nodule, reducing guesswork and subjective judgment. This approach can help distinguish cystic from solid lesions, as cysts generally have very low WHO values, making them easier to identify correctly. Accurate measurement of WHO values can also help avoid unnecessary biopsies by providing clear, objective data about the lesion's nature. In practical terms, WHO measurements assist radiologists during lung cancer screening or diagnostic scans. They help determine whether a nodule should be monitored over time, biopsied, or treated immediately. WHO data also contribute to staging, which is the process of figuring out how advanced the cancer is. By understanding the tissue composition and vascularity of a tumor, doctors can better plan treatment and predict outcomes. In summary, Hounsfield units are a vital tool in lung cancer imaging. They give a numerical way to evaluate tissue density and enhancement, helping distinguish malignant from benign nodules. This information supports accurate diagnosis, appropriate management, and better patient care. Remember, always consult healthcare professionals for personalized advice, as each case is unique and requires careful assessment based on comprehensive clinical information.